Okay, good afternoon, class. This is Dr. Gasco, and we're going to have a lecture on the generalities of the nervous system. So, we'll take up first. Actually, this was already taken by Dr. Sanoria during her lecture. So, this is just some add-ons to her lecture. First, we have here the neuron, the one that conduct electrical stimulus. Okay, a difference between neuroglia, which the primary function is for support and does not conduct stimulus. Now, so we have here the neuron divided to the axons, the dendrites. Yes, I would just like to warn you with regards to the terminology. Sometimes in the book, the dendrites, not called dendrites, you just refer it as peripheral connection. So when you say peripheral connection, that represents the dendrites, while the axon is sometimes referred as central connection fiber. That refers to the fiber that conducts the impulse from the body towards the CNS. Now, we know already that the central nervous system is divided into the nervous system divided into central nervous system and the peripheral nervous system. The central nervous system refers to the brain and the spine, the brain, the encephalon, the brainstem, the spinal cord, while the peripheral nervous system refers to the structures located outside the brain, the spinal cord, and that what would be the cranial nerve or cranial nerves, and as well as the peripheral nerves. So with regards to the cranial nerves, you have 12 in numbers. You should be able to know that already. So as a sort of review, cranial nerve number 1 is olfactory. Cranial nerve number 2 is optic. Cranial nerve number 3 is oculomotor. Cranial nerve number 4 is trochlear. Cranial nerve number 5 is trigeminal. Cranial nerve number 6 abducens. Cranial nerve number 7 is facial. Cranial nerve number 8 is vestibulocochlear. Cranial nerve number 9 is glossopharyngeal. Cranial nerve number 10 is vagus. Cranial nerve number 11 is spinal accessory. And cranial number 12 is hypoglossal nerve. Okay, so these are the 12 cranial nerves, mostly found in the brainstem. Well, we know that already that the spinal nerves are composed of 31 pairs. You know already what are the spinal, the 12 pairs of spinal nerves. Now, we'll take up the formation of the spinal nerve. By the way, before we go into that, there are other structures belonging to the peripheral nervous system. They have a collection or a group of neurons located outside the central nervous system, located outside the CNS, outside the brain, the spinal cord. This collection of neurons are called the ganglion, or we call ganglion or pleural ganglia. Okay, and this example to that is you have here the posterior root ganglion. This is sensory. Then aside from that, you have other ganglion, the ganglion or ganglia of the autonomic nervous system, and you have also the ganglia that are located in the abdominal region. If you still remember the so-called Celiac Ganglion, okay. So you have those are belongs to the peripheral nervous system. Some are found in the intestinal tract, the mesenteric plexus, the auerbachs. So these are parts of the peripheral of the peripheral nervous system. Now, so a collection of neurons that are located inside the brain and the spinal cord, they are called nucleus or pleural nuclei. Okay, example to that, a very good example are the basal nuclei. So the nuclei there refers to the collection of neurons or group of neurons located inside the brain, primarily in the white matter of the brain. So the ganglion, if it's peripheral, the collection of neurons, and if it is in the CNS, we call that nucleus. Okay. Now, so we have here we'll take up formation of the spinal cord, the spinal nerve. You see, the spinal nerve is formed by the two roots. You have the posterior root, and you have the ventral or the anterior root. Now, this posterior root is formed by a collection of rootlets. We call the posterior rootlets. The same is true with the anterior root, formed by the collection of group of rootlets, the anterior rootlets of the spinal nerve. This one. Okay, so if you try to compare the two, posterior root is purely sensory. Purely sensory. It is bigger in size compared to the anterior root. So the anterior root is smaller in size and it is purely motor fibers. The fibers there are purely motor, or we call that efferent fibers. While the other one we call the sensory fibers or afferent fibers. Okay? So they're bigger in size. And there is a collection of neurons found in the posterior root. We call that the posterior root ganglion, which is sensory. Okay? Now, during the development, embryonic development of the CNS, there is the so-called sulcus limitans. The sulcus limitans bisects, divides the neural tube into two. The posterior, we call the alar plate, are sensory. So, you will notice that most of the sensory fibers and neurons are located in the posterior dorsal part, while the ventral part are composed of mostly motor fibers, motor neurons. On the lateral part, that would be a mixture of sensory and motor. Okay, so posterior is usually sensory, anterior is usually motor. Okay, so you have here the posterior root ganglion. So as mentioned earlier, in a ganglion, you have a collection, this called collection of neurons. And this is being exemplified by this picture here. So if you see this picture, this duct, that refers to the body of the neuron. No? This circular dot, small circular dot, that refers to the body. And the one here, these fibers, that refers to the fibers of the sensory, the body of sensory neuron. So you can refer this as the afferent or the sensory fiber. Okay. In fact, you can call this the peripheral connection, and you can call this the central connection of the sensory fiber. So now the posterior root, the anterior root unites with each other to form the spinal nerve. So you see the spinal nerve composed now of mixed fibers, mixed sensory and motor. Okay, so spinal nerve together with its branches of the spinal nerve, you have a big anterior ramus and a smaller posterior ramus. So these branches contains mixed nerve fibers. So what happens here, the fibers are separated when they go into the roots. So the sensory is found in the posterior root, the motor are found in the anterior root. Okay. So the spinal nerve is very short. No, it passes through the intervertebral foramina. You come here, you have another picture here. Okay, this is another picture. So you have here again the ventral, the anterior root is smaller. You have the posterior root bigger in size, and it has a dilated part, which is the site of the posterior root ganglion. So the spinal nerve is very short, around 1 inch only, passes through the this is called the intervertebral foramina, here. Immediately divides into two. The anterior ramus, which is bigger in size, and is responsible for supplying the anterolateral part of the body. Anterolateral part of the body. While you have another smaller branch, the posterior ramus, which is responsible for supplying the back or the posterior part of the body. Okay? So the anterior ramus will sometimes fix or fuse with each other, no? To form a plexus. So you can have this brachial plexus here, lumbar plexus, sacral plexus. So the term plexus can be used in the nerves. You know, you have nervous plexus, okay, and in the veins, venous plexus. Okay, so you have this one here. Okay, so okay, now you have another important structure that is connected to the spinal nerve. Okay, and this is the so-called the ganglion of sympathetic trunk. So ganglion again. So you encounter here with another term, ganglion. Okay, so you have here a collection of neurons, but take note, this is a sympathetic ganglion. And sympathetic ganglion usually is a motor. This is a motor or the motor ganglion of the sympathetic nervous system. So this is a ganglion, collection of neurons, which is motor. This is a ganglion here, again, collection of neurons, but this is sensory. Okay? And this is what this one is connected. The sympathetic ganglion is connected to the spinal nerve by two branches. We call here the gray ramus branch or the gray ramus communicans here, and the outer one you have the white ramus communicans. We call it the white ramus communicans. The other one is the gray ramus communicans. Okay. Now the white ramus communicans is the area or the site where the afferent fibers will pass through. Afferent fibers will pass through. White. While in the gray ramus communicans, the fibers that will pass through are the efferent. Efferent fibers pass through the gray ramus communicans. Okay. Okay. You have this illustration here. The general arrangement of the somatic nervous system as well compared to the autonomic part of the nervous system. Okay. So the autonomic nervous system divided into sympathetic and parasympathetic. And they are found where? They are found both in the CNS and also in the PNS. Both in the CNS as well as the PNS, the autonomic nervous system. Okay. Now, what are the differences of the somatic as well as the autonomic, which sometimes called the visceral nervous system? No? When you say visceral, that refers to the autonomic nervous system. Okay. You have mentioned before the somatic reflex arch at the level of the spinal cord. So this one was been illustrated already, and it composed of 5 elements. No, we have here the skin, where you have the sensory receptor organs in the skin. What are the sensory receptor organs in the skin? For the pain, you can have naked nerve fibers. You have passenger corpuscles. So remember, so-called the Rofinis. Okay, so you have sensory receptor organs here. So if there is pain nerve endings, for example, in the skin, the pain sensation is conveyed by the sensory fibers. We call this sensory fiber. Okay, or sensory neuron, afferent neuron here. So that is element number 2, the afferent neuron. Element number 1, sensory receptor. Sensory receptors in the skin. 1, number 2, afferent neuron. Okay. Now number 3, you have connector neuron. Okay, connector neuron. As the name implies, connector neurons connects the afferent to the efferent, the motor neuron. The motor neuron here, which is located in the ventral horn of the spinal cord, gray matter of the spinal cord. So 1, 2, 3, 4. So number 4 would be the motor neuron in the anterior horn, and then number 5 will be the effector organ, which would be the muscle. So that is for the somatic. So when we compare it to the autonomic, first take note that the fibers in the sensory neuron are here, afferent neuron, the same with the somatic neuron, meaning to say, why are they the same? Because the cell bodies of this afferent neuron are also found here in the posterior root ganglion. So the posterior root ganglion, the neurons here, are composed of somatic neurons and visceral neurons here in the, because try to see the picture, this goes into the posterior root ganglion. Okay, so then goes inside, but where will it go? It will go into the lateral horn, lateral column or lateral horn of the gray matter. Okay, and what is found here in the lateral horn or the lateral column of the gray matter? You have the sympathetic connector neuron. Okay, the sympathetic connector neuron is not an ordinary neuron. It is the neuron that will give rise to the preganglionic sympathetic fibers. Take note, that is one big difference between somatic and autonomic. In autonomic, we have the so-called preganglionic and postganglionic fibers. So the sympathetic connector neuron here will give rise to the so-called preganglionic sympathetic fibers. So this one, this is the so-called preganglionic sympathetic fibers. And where will it go? It goes out into the spinal nerve. Then, as in this picture here, it goes into here in the ganglion, the sympathetic ganglion. We can call that the paravertebral sympathetic ganglion because they are found at the sides of the vertebral column. So we have the paravertebral sympathetic ganglion. Okay, and it will pass through the afferent or the white ramus. Yeah? It passes through the white ramus communicans. So as mentioned earlier, the white ramus, the structure that will pass through the fibers are afferent. So this is an afferent fiber passing through from the stomach, passing through the white ramus. Okay, so this preganglionic sympathetic fiber also passes through the white ramus communicans, and then what will happen next? It can synapse here. It may synapse with the neurons here. So you know already the word synapse, no? Communication between neurons or a neuron and on an organ. We call that a synapse. So it can make synapse here. And the efferent, after making the synapse here with the neurons, okay, the fiber that comes out from that neuron is now called post-ganglionic sympathetic fibers. And this is simplified, this fiber which is color black. So this is a neuron here, as mentioned before, this dot, small dot, black dot structure. So, that refers to the body of the neuron. So you try to see here, it makes synapse with that dot, with that neuron, and the fiber coming out from that neuron is called the post-ganglionic sympathetic fibers, and it will exit through the gray ramus communicans. So it goes back to the spinal nerve, and it's now ready to be transported into the effector organ. Okay. But in this picture here, what you also take note that this preganglionic sympathetic fibers has three choices. One, it may synapse with the neurons inside. Number two, it will bypass the ganglion here and goes out away from the ganglion, away from paravertebral sympathetic chain, and look for another ganglion outside the paravertebral chain. And in this one here, it will make synapse with a neuron found in the abdominal cavity. This is the so-called celiac ganglion. So celiac ganglion is a sympathetic ganglion. No? So if you encounter the term celiac plexus, when you say plexus, that will be a composition of sympathetic and parasympathetic. But if you say celiac ganglion, it is purely the sympathetic ganglion. Okay, so it makes synapse here, and the fiber that comes out from this sympathetic ganglion, a motor sympathetic ganglion, is called post-ganglionic sympathetic fibers. So this is a post-ganglionic sympathetic fibers, and will make and we go into the effector organ. So if you try to go back to the reflex, the viscous here, this is the stomach, and element number one, it would be sensory receptors found in the stomach. The sensory receptors found in the stomach. Receptors or pain receptors in the stomach, the pain receptors, the sensation will be conveyed by the afferent. This one, afferent neuron, goes out and passes through the white ramus communicans, goes into the posterior of the horn, and then makes synapse with the neurons here. We call the sympathetic connector neurons here, make synapse, and then the fibers that comes out would be the pre-ganglionic sympathetic fibers, goes out via the ventral root, goes to the spinal nerve, passes through the white ramus communicans, bypass the paravertebral sympathetic ganglion, goes into the region of the stomach, makes synapse with the celiac ganglion in the stomach, and then what comes out would be the post-ganglionic sympathetic fiber and goes to the effector organ. What would be the effector organ in the viscous? That would be the glands. And usually the response would be a secretion of the glands. So pain, go out, then the reflex arch, back to the effector, and you have the secretion of glands. as it's the response of the effector organ. Okay, so quite difficult to when you compare the two. You have many differences. Okay, now this is the another picture which illustrate the autonomic nervous system. Okay, so take note again. We take up first the sympathetic, and we know that the connector neurons, the connector neurons, which will give rise to the preganglionic sympathetic fibers, are found in the lateral horn of the gray matter of the spinal cord. Lateral horn of the gray matter of the spinal cord. Now, take note that the connector neurons in the lateral horn are found not in the entire length of the spinal cord, not in the entire length, but only from T1 to L2. T1 to L2. Okay? That is why the sympathetic nervous system is sometimes called the thoracolumbar outflow. Thoracolumbar outflow. Because it only found from T1 to L2. Okay? The sympathetic connector. But the ganglion, okay? Take note of the ganglion. Okay? Each of this one has its own ganglion. We call it the chain, the paravertebral chain of ganglia, sympathetic ganglia. Paravertebral sympathetic chain of ganglia. Okay? So you have found here. And take note, it extends even if the connector neuron is found only at the level of L2, the ganglion, the ganglia, will extend down into the lumbar and in the sacral. Lumbar and sacral. Okay. So, the same is true here in the cervical. You have no connector neuron in the cervical segments, but you have cervical sympathetic ganglion. In fact, you have this divided into the superior sympathetic ganglion, the middle sympathetic ganglion, and the inferior sympathetic ganglion. Cervical, the superior cervical sympathetic ganglion, middle cervical sympathetic ganglion, and inferior cervical sympathetic ganglion. So, you might ask, how do this ganglia here receives the preganglionic sympathetic fibers? Now, this ganglia will receive the preganglionic sympathetic fiber from, take note, this T1. Okay? Try to see the fibers, the preganglionic sympathetic fibers of T1. Okay? From here, when it reaches the chain of ganglia, it goes up. It goes up to supply fibers to this ganglia here. So that's what happens to T1. Goes up. How about in the lumbosacral? It is usually the L2. Okay? The connector neuron L2. The fiber, the preganglionic sympathetic fibers. And here, when it reaches the ganglia, goes down. Goes down. Okay? To supply the different ganglia in the sacral region. Okay. So, as mentioned before, what will happen? This, for example, this one here, the preganglionic sympathetic fiber goes into the ganglion, makes synapse. No? By the way, when you encounter the term, okay. If you see a dot like this, that refers to the neuron. If you see this one making a letter Y, this one refers to the synapse. So this is the body, and this is the synapse formed by the fiber. So why? Okay. So like this, for example, take note. There's a dot. That is the neuron. This is the preganglionic sympathetic fibers. There's a Y, meaning it makes synapse with the neurons here in the ganglion. And the efferent or preganglionic, the postganglionic, the postganglionic fibers are represented by these broken lines. So these broken lines here, it refers to the postganglionic sympathetic fibers. Okay. Now, take note that, again, the fiber may synapse with the neurons in the paravertebral ganglion, or, like in T1, it may go out to another ganglion located above, or the third option, it may bypass, like this, for example. You notice that it is a connecting line, not dotted, not a broken lines, So this one here, this is a preganglionic sympathetic fibers. And this is what the celiac ganglion. The fibers, the preganglionic sympathetic fibers, make synapse, letter Y, synapse with the neurons here. And these broken lines refers to postganglionic sympathetic fiber. Postganglionic sympathetic fibers. Okay, so when you encounter the term celiac ganglion, superior mesenteric ganglion, renal ganglion, inferior mesenteric ganglion, take note, if it is a ganglion, it is a sympathetic ganglion. But if the term is plexus, celiac plexus, superior mesenteric plexus, that is a network of fibers composed of sympathetic and parasympathetic. So the plexus refers to a collection of sympathetic and parasympathetic fibers. Celiac plexus. While when you say ganglion, it is a sympathetic ganglion. Okay? So that is the thoracolumbar outflow. Okay. Now, you may question again, ask, how would, because this is only up to here, the superior cervical ganglion, how would the structures found in these fibers here goes into the eye, lacrimal gland? How? When you have here up to this only. Okay, I will illustrate. Okay. Never mind. That will be discussed again. There is a branch here. That goes up. Okay, it will be discussed when we region the neck. That branch that comes from the superior cervical ganglion is called the internal carotid nerve. Okay, that is the largest branch, internal carotid nerve. That internal carotid nerve will follow or will go into the carotid artery, the common carotid artery. Once it reaches the common carotid artery, this branch will break into network of fibers in the artery, and we term that network of fibers in the artery as carotid plexus. So when you encounter the term carotid plexus, these are sympathetic fibers coming from the internal carotid nerve. Internal carotid nerve comes from superior cervical ganglion. So that is how this sympathetic nervous system was able to give supply to the structures found in the head. Okay, because the blood vessels, the arteries that supply these organs contain sympathetic fibers coming from the carotid plexus. Okay, so So that is for the sympathetic nervous system. Now we'll take up the parasympathetic nervous system. If you call this one, the sympathetic, as thoracolumbar outflow, the parasympathetic is called craniosacral outflow of the autonomic nervous system. The craniosacral outflow of the autonomic nervous system. Why cranio? Because the parasympathetic fibers in the brain are carried by cranial nerves. What are the cranial nerves that carry parasympathetic fibers? Cranial nerve number 3, which is oculomotor. Cranial nerve number 7, which is facial. Cranial nerve number 9, which is glossopharyngeal. Cranial nerve number 10, which is vagus. These cranial nerves carry preganglionic parasympathetic fibers. And where is the origin of these preganglionic parasympathetic fibers? From a group of neurons inside. So, we have here a dot. This dot refers to the neuron, a collection of neurons here. And what do you call? We don't call it ganglion. We call it nucleus. Nucleus. So what are these here? That this is the motor nucleus of oculomotor nerve. Another dot, this is the motor nucleus of the facial nerve, motor nucleus of the glossopharyngeal nerve, motor nucleus of the vagus nerve. Okay? So that will be discussed again when we take up the cranial nerves of the brainstem. So this will give rise to the preganglionic parasympathetic fibers. Take note, it is preganglionic. So it will have to make synapse with a ganglion located near the organs. And what are these ganglion? For example, you have here ciliary ganglion, submandibular and sublingual submandibular ganglion, or otic ganglion. Okay, so take note that this otic, ciliary, not found here. You have submandibular ganglion, the pterygopalatine ganglion, not found here. Take note, these are what? Parasympathetic ganglion. Okay, so try to make do not be confused with this ganglion here. These are parasympathetic, while this was celiac ganglion, superior mesenteric ganglion, inferior mesenteric ganglion. These are sympathetic ganglia, while ciliary ganglion, submandibular ganglion, otic ganglion, these are parasympathetic ganglia. Okay, so after making synapse, you have here the broken lines, and that is already the postganglionic parasympathetic fibers. These broken lines here, postganglionic parasympathetic fibers. So they supply for example, the eye, lacrimal gland, submandibular, sublingual, salivary glands, parotid gland. Okay. Now, among the cranial nerves, the one that has most extensive parasympathetic fibers is the vagus nerve. Okay. Most of the cranial nerves are found only at the region of the head, or at most the neck, but never down. It was only the vagus nerve which goes into the region of the thorax, into the region of the abdomen, abdominal region. Okay, so if you try to see the preganglionic parasympathetic fibers, it will participate in the formation of the plexus here. We call the aortic or cardiac plexus, in the pulmonic plexus. So when we see plexus here, that already composed of the sympathetic and parasympathetic. So it supplies here the organs of the thorax, the gastrointestinal tract. Okay, so here, take note in the region of the gastrointestinal tract. There is a limit for the blood supply of the vagus nerve. The vagus nerve will supply only here, up to here. The proximal one half of, still remember what colon? This is called transverse colon. The transverse colon. So for the gastrointestinal tract, the extent of the vagus nerve supply is only in the up, down to the proximal half of the transverse colon. So how about the others, the rest here? There is now another part of the parasympathetic supply. We should craniosacral outflow. Why? Because you have another group of neurons, this one found in the lateral horn. These neurons here found in the lateral horn. These are called connector neuron, but they are not sympathetic. While the connector neuron here, we call this the sympathetic connector neurons. But here, we call this parasympathetic connector neurons located in the lateral horn. This is 2, is 3, is 4. Will give rise to a nerve called pelvic splanchnic nerve. Okay, pelvic splanchnic nerve, therefore, is a parasympathetic nerve coming from is2, is3, is4. Okay. And this is the one that is responsible for supplying the organs in the pelvic regions. The pelvic organs are supplied by the pelvic splanchnic nerve. It will also supply the intestinal tract, starting from the distal half of the transverse colon down to the descending sigmoid and rectum. Okay, how? By participating in the formation of the inferior mesenteric plexus. Inferior mesenteric plexus. Okay. Now, you will notice that the oculomotor has its own ganglion, the facial nerve has its own ganglion, the glossopharyngeal, how about the vagus? You will notice there is no otic, there is no submandibular, there is no ciliary. Why? Because the ganglia, no, for the vagus nerve are located within or near the organ supplied. They can be located within the capsule or within the wall of the organ supply. Like this, for example, the stomach. Okay. These are found on the outermost layer, which we call the serosa. So that is where you can find a ganglion, for the vagus nerve. So again, the ganglia of the vagus nerve are located within or near the organs supplied. That is why the dotted lines, the broken lines, very short. The broken lines very short because they are found in the organs supplied. Okay, I hope you understand the lecture. It's very short, and I think I covered already the important ones. So that is all for this afternoon. Thank you for listening.